Guyanese. I'm Dr. Artenisa Hamilton, Director of Primary Healthcare Services. And today I have with me Dr. Dennis Basir, Men's Health Coordinator, who has joined me to follow up and reinforce yesterday's message, which focused on our male population. Dr. Basir?
I am Dr. Dennis Basir, Men's Health Coordinator, and I will be speaking to you men about COVID-19. Man to man, pride only hurts. It never helps. Greetings to you men of Guyana. As the world continues to fight against the novel coronavirus 2019, which has now become commonly known as COVID-19, Guyana is no exception. For our relatively small population, we have seen an alarming rise in the number of cases, with the majority being men. As of yesterday, you were informed that the ratio stands at 71 males to 54 females. Of the 10 deaths, 8 are males. These men are between 16 and 59 years old. Region 4 is the most densely populated region, and as such, 80% of the registered cases have been found in Region 4. This clearly indicates that persons are not taking note of and putting into practice the strict guidelines for the prevention of the transmission of COVID-19. It is a general understanding that men have poor health-seeking behavior. This is further emphasized by the current situation. But wait, the plot thickens. Lots of males that have been positively diagnosed are not single. As a result of this, their partners and their children have to be tested due to them being exposed. There is no shame in wearing a face mask, in practicing social distancing, or even in constantly sanitizing your hands. There will be no loss of pride, but there could be loss of health and/or life for you and your loved ones. The Men's Health Unit of the Ministry of Public Health has not been idle during this time. We believe you cannot be for the people if you cannot be of the people. I say that to say this. We are on the road. We have seen the gatherings at the bars and corner shops during the day to compensate for the closure from 6 p.m. And at nights, way after the 6 p.m. hour, you are still hanging out with the boys on the road, having parties, and even playing football. Through the hotline of the Health Emergency Operations Center, it has emerged that men think COVID-19 is not in their area, or because our number of positive cases and deaths is low, that it is under control. I am pleading with you, men, to think about your family, your communities, and your country. Stay home. Practice social distancing and wear your face masks. Get to know the recommended guidelines and put them into practice. Because if it is that you don't like the way COVID-19 has the country right now, please know that you are prolonging this period every time you don't practice the preventative measures, and the only one you have to blame is yourself. Thank you for listening. Go with God and stay safe, men.
Thank you, Dr. Basir. Now, guys, you heard the appeal, and I hope that Dr. Basir was able to convince you that your love of family matters more than anything else. So do the right thing and encourage your friends too. We are all in this thing together. So put that pride aside and keep your family safe, if indeed you really care for them. I also want to call on our faith-based leaders and other reputable persons in society to help us get this message across to our men. You have a vital role to play also, and it is imperative that our men hear this appeal from all quarters. We must protect the family, particularly our children who have been away from school, whose play outside has been disrupted, who can potentially face discrimination just because the father did comply with the guidelines. And now for the global report. Globally, the statistics according to WHO are as follows. The total number of cases is 4,789,205, with 318,789 deaths. In the region of the Americas, the total number of cases is 2,105,670, with 125,843 deaths. The situation in Guyana is as follows. We are reporting 2 new cases today, both males. And so our number of confirmed cases now stands at 127. The figure that you can see on the screen is the pie chart that we would have put together looking at all of the positive cases to date. The breakdown that you can see of male to female is now 73 to 54. To date, the total number of persons tested is 1,329, with the total number of negative cases being 1,202. We currently have 57 persons that have recovered, and we are very happy to report this. 60 active cases in institutional isolation, 3 patients in the COVID ICU, and the number of deaths remains at 10. The ministry is very concerned with increased cases seen in regions 1, Burima-Waini, and 7, Kayuni-Mazaruni. As of today, Region 1 now has 2 confirmed cases in 2 of their sub-districts. Region 7 has a total of 7 cases. This is not good. My fellow Guyanese, this is the situation that we were working so hard to prevent. If you look at the graph on the screen, it displays the number of confirmed cases since the index case of the coronavirus disease was detected on the 11th of March 2020. The surveillance component of the Health Emergency Operations Center provided an overview and analysis of the surveillance data collected up to the 16th of May 2020 on the above mentioned cases. You will notice that from the 11th to the 19th of March 2020, there were 6 cases. 19th of March to the 2nd of April, 17 cases. The 3rd of April to the 4th of May, the first phase, when the curfew was implemented, there were 69 cases. 5th of May to the 16th of May, 23 cases. You will see from the pattern that the expected results from the measures implemented that persons have not participated fully. Where it was expected that the transmission would have slowed, we are still having new cases every day. I wish to remind you that the Ministry of Public Health cannot be the only participant in this fight. We need you all to come on board. We can defeat this disease. So I urge you, please observe the guidelines provided and continue to stay safe and healthy. Thank you.